Spotlight, lectures and performances on and around Albany State University.
Good afternoon. My name is Courtney Buck, and I'm the current president of the Student Social Work Association here at Albany State University. I would like to welcome you to the Spring 2012 Social Work Symposium. The 6 students presenting today have worked hard throughout the semester to ensure that we find this symposium both enlightening and informative. Please give them your undivided attention as they present their senior presentations. Thank you and enjoy.
I would like to welcome Dr. Spearman, our director, our chair of the social work department, to address our crowd today. I thank you for your patience. Dr. Spearman.
I'm going to say hello, and I haven't seen all of the graduates for a while. Hopefully their experience have been good, and they're all looking forward to moving to the next level and or to working. That's what we try to prepare you for. I want you to know and understand that we want the best for you. We want to to see that you go forward, and anything that we can do for you, you need to contact us and let us know. I think that sometimes when students leave these walls, they don't look back and know how much the folks that they have seen throughout their 4 years can do or say for them. And I think this is a time that you have to go back and tap all of your resources. We are your resources regardless of how you feel when you leave here. Make sure that as you move along, and those of you who are talking about going to the master's level, you know that already because you've had to ask for references and things like that. But know that even beyond that, if you're in a situation where you need to call back and discuss with someone, do that because we do it all the time. And I wish all of you, the presenters, especially the presenters, it's kind of nerve-wracking to stand before a group, even though you know them. But know that this will be not, if this is your first experience, it will not be your last. Because social workers are always called upon to present or to do something. And most of the times it's spontaneous. It's nothing that you know about, like today. But anyway, I wish you well, and I'm gonna, when I leave, I'm gonna leave because I got someplace else to be. And I want you to know that my heart and mind is with you, and hopefully everything will be successful. Thank you.
Thank you, Dr. Spearman. It's always a treat to have us addressed by the chair of our department. And I am going to call Dr. Farrow to come and address our seniors. And if you don't know, Dr. Farrow is your senior advisor. So when you become a senior, you will be seeing Dr. Farrow. Dr. Farrow.
How are you folks? First and foremost, I'm going to apologize to the seniors for flunking them softly. So next time, I'm not going to flunk you too hard. We thank you for your efforts, for putting in everything that we threw at you. Now, this is the time for you to showcase all that you've gotten from us. Now, the advice I'm going to give you, please do not begin to settle to make families and continue to go to graduate school. Graduate school is the way. And make your family to be very proud of you. And I've enjoyed working with you. And I'm sad that I can't flunk you again. But other than that, you are all wonderful souls. I love you all.
Thank you, Dr. Farrow. As you see, I'm using my leadership skills to force people to do things that I need for them to do. And Dr. Farrow is an integral part of your education here because you all come to my class and tell me how much you love Dr. Farrow. And it's a little intimidating and I feel like I have to win you all over, but it's okay, Dr. Farrow. I thank you. We also have in our audience some of our other faculty members, Dr. McCants, who teaches in our bachelor's program as well as our master's program, Dr. Page, who this year is teaching one of our bachelor's program, courses, and he teaches in the master's. We have several other professors, and they are dribbling in and out, and I thank you all for coming. Today is a very important day for my students, and I call them my students because I am the last one that gets to see them before they graduate in all their splendor and glory. And trust me, it's been a long semester, wouldn't you agree? It's been a very long semester, but I think what's important to do today is to celebrate their accomplishments and what they have done. Now, many people don't really know what social work is about, and they may equate social work with DFACS or public welfare, but what you're going to see today is a variety of social work skills and roles that have been played, and what I would say settings where we practice social work. So we are diverse. We engage at the micro level, meaning with individuals, groups, and families, and the macro level with communities. And what I would like to say today is, again, congratulations. Ladies, you've done well. And we're going to dim the lights and start with the first presentation. How it will go is one presenter will present after the other. At the end, we have the chat and chew, or you'll see next door in Ballroom 2. You'll be invited to pose questions to the presenters. So in the interest of time, we won't take questions until the end. Some other logistics, the bathrooms are outside. We have some lemonade in the back if you're thirsty. Ice is coming. And just for I think I'm looking at this crowd, and most of you all are social workers or social work students, and you're familiar with what we're doing. Our students will present their biopsychosocial assessments. Some will use a biopsychosocial model. Some would use an ecological systems perspective model. And these are two types of assessments that we use to assess our clients and the work that we do with our clients. And I believe that you will find the presentations interesting, rewarding, and you will learn something. So I'm going to call to the stage the first presenter, who is delighted to present to you today, Ms. Miriam Jenkins.
Good afternoon. My name is Miriam Jenkins, and this is my biopsychosocial assessment. My field placement was conducted at South Albany Medical Center, and my field instructor was Ms. Dawn Robinson. And this is my client that I assessed. This is a fictitious person. This is not Ms. Martha Johnson. But Ms. Martha Johnson, she's an African-American female. She's 56 years old, and she's married. The presenting problem. Ms. Johnson came to South Albany Medical Center to receive treatment for her hypertension, which is also known as high blood pressure, and her diabetes. And while doing her assessment, it was revealed that she's a victim of intimate partner abuse. Chronology of presenting problem. In 1971, that's when Mrs. Johnson and Mr. Johnson became a couple. In 1972, Mrs. Johnson witnessed Mr. Johnson abuse a teenage girl. In 1973, Mrs. Johnson also witnessed Mr. Johnson abuse his sister. And in 1978, that's when the intimate partner abuse began. Her first son was born, and that's when she discovered she had hypertension and diabetes. And in 1993, Mrs. Johnson was raped by her husband, and her second son was conceived. And from 1993 up until now, 2012, the intimate partner abuse continues. In February of 2012, that's when Mrs. Johnson left Chicago and came to Albany, Georgia to stay with one of her friends, and that's when she came to South Albany Medical Center. Okay. The process at South Albany Medical Center, for each new patient, we do an assessment called an initial assessment, where we gather information about the patient, such as date of birth and their reason for visiting. And while assessing Mrs. Johnson, it was revealed that she was a victim of intimate partner abuse. And I chose to discuss the ecological perspective. And this is the Ecological Systems Map. And this map represents the different levels associated with Mrs. Johnson's life, such as the micro, meso, exo, and macro. and I'll describe each level during my presentation. The micro level. Mrs. Johnson was born in Robin, Illinois, January 15th, 1956, to Daniel and Mary Johnson. She has one brother, which is Tony Johnson, and during Mrs. Johnson's childhood, she grew up where she witnessed her parents argue most of the time, and she's a product of a low-income family. Okay, the relationship. Mrs. Johnson met Mr. Johnson in high school. She was a sophomore, and he was a junior. They have been together for 40 years, but they have been married for 30 years, and they have 2 sons. One is 34, and the other is 19. The husband. Mr. Johnson is a social worker, and he has been a social worker for 35 years. He's on the board of the Christian Education, and he also has a leadership position in his church. He drinks, and his drinking has escalated to a drinking problem, and Mrs. Johnson stated that he is very controlling. Okay, this is the genogram. Let's see if I can. Mary Johnson is her mother, Daniel Johnson is her father, and Tony Johnson, that's the brother. And the squiggly line with the gray dotted line going through, that stands for a distant hostile relationship, because Tony Johnson does not communicate with his parents or his sister, and they haven't seen him in 20 years. And Martha Johnson and Mr. Johnson is married. The blue line going to Martha Johnson states that it's physical abuse within the relationship, and the red line under that indicates that there's violence within the relationship. And Anthony Johnson and Jason, the ones at the bottom with the green line going across from each other, that represents that they're close. And from the children going to the mother, that represents that they have a close relationship with their mother. Okay, family dynamics. Mrs. Johnson spent most of her childhood with her grandmother, her aunts, and many cousins. And growing up, she grew up in a religious family where they went to church every Sunday. Okay, the Mezzo Level. This level consists of the systems Mrs. Johnson is connected to. She's connected to South Albany Medical Center, Albany State social work intern, which is myself, a few friends, her job, and her local home church. The EXO level consists of the laws that governs each system. And South Albany Medical Center, it's an MUA that stands for Medically Underserved Area, and it was designated to areas or populations having a shortage of personal health services according to the U.S. Department of Health and Human Services. And what determines an MUA is usually the poverty rate or the percentage of the elderly population, which is 65 and older. And in Chicago, Illinois, they have certain domestic violence laws, and one states a person who, in committing a domestic battery, intentionally or knowingly causes great bodily harm or permanent disability or disfigurement commits aggravated domestic battery. And usually when someone commits a crime, that's when the law enforcement gets involved. The macro level. This level represents her culture. Mrs. Johnson is a Christian, and within this religion, the men is usually the head of the households, and women should submit to their husbands. Mrs. Johnson is an African-American female, and according to research, African-American women are more likely to experience intimate partner violence than any other ethnic group. Patriarchy. Mrs. Johnson grew up in a patriarchy society where the male is dominant, where the male represents. In traditional gender roles, women are expected to balance home and work. Okay, the intervention strategies. Mrs. Johnson received treatment from South Albany Medical Center. We provided her medication for her hypertension and her diabetes, and we referred her to different services for the intimate partner abuse. She has not had any past interventions for the intimate partner abuse, but her planned intervention, she will meet with the church, with the leadership to discuss what has been going on in her relationship, and she will be enrolled in counseling. Okay, the empowerment theory. I chose the empowerment theory, and the Brazilian humanitarian and educator Freire created it. And he suggested a plan for liberating the oppressed people of the world through education. And many disciplines use this theory, such as social work, psychology, sociology, and education. And the empowerment theory, it helps clients overcome psychosocial barriers to create an environment where self-actualizing may occur. And the goals of the therapeutic relationship, the goals are determined by the client. The social worker cannot come up with the goals. They can help, but they cannot develop the goals. The client must be open and willing to try new experiences. They must develop positive relationships and assume personal and social responsibilities. The cultural diversity issues. Mrs. Johnson is a middle-aged African-American female from Illinois. She's getting older, so with her experience in domestic violence, it brings on more issues such as suicidal thoughts, anxiety, and things like that. And being African-American, soul food is a part of the culture, but since she has hypertension and diabetes, she cannot enjoy most selections incorporated with the culture. And growing up in Chicago, gangs are very popular there. So she grew up in an environment with violence, and she saw her parents argue all the time, so she grew up in a hostile environment. The ethical issues. There was no church leadership helping Mrs. Johnson with her domestic violence issue. And in Ephesians 5:25, stated in the Holy Bible, husbands should love their wives just as Jesus loved the church. Another ethical issue is Mr. Johnson violated Mrs. Johnson's personal space. He also violated the laws, and Ms. Johnson hasn't had any past treatment for the violence she's experienced. And the recommendations on the individual level, the individual should not go back to the same environment, person, or home. They should seek help even if afraid. And on the community level, no one should wait. They should act as soon as possible and reach out to different organizations such as No More, Say More, National Center for Victims of Crime, and Futures Without Violence. These are my references.
Good afternoon. My name is Shakira Jones. My field placement was conducted at Phoebe North, which is a nonprofit acute facility. The facility has 248 beds. Some services offered at the facility include a 24-hour emergency center, bariatric surgery, which is also known as weight loss surgery, diabetes care, diagnostic services such as MRIs, inpatient, outpatient services such as physical therapy and speech therapy, laboratory medicine, pain treatment, surgical services, vascular lab, and kidney care. My patient has been given a fictitious name and will be referred to as Mrs. Jackie Stinson. Jackie Stinson was admitted to Phoebe North on February the 11th, 2012, with complaints of shortness of breath. This was her second admission this month. Her prior admission was due to pneumonia and chronic obstructive pulmonary disease. Pneumonia is a lung infection, and COPD is a lung disease. The two most common forms of COPD are emphysema and chronic bronchitis. History of presenting problem. Ms. Stinson has had a numerous amount of hospitalizations. In January 2009, she was hospitalized for shortness of breath. In May 2011, she was hospitalized for wheezing and fever. In December 2011, she was hospitalized for coughing and sputum production, which is also known as mucus production. In February 2012, she was hospitalized for pneumonia and COPD, along with shortness of breath. The assessment of problem will be looked at from the biopsychosocial perspective, which includes the biological dimension, the social dimension, and the psychological dimension. Ms. Stenson is a single Caucasian female that is 79 years of age. She has a past medical history of hypertension, which means high blood pressure, Crohn's disease, which is an inflammatory bowel disease, which causes inflammation in the digestive lining, which can be a cause of severe diarrhea, hypokalemia, which is low potassium, and potassium is needed for cells to function properly. Osteoporosis is bone loss, and bones become weak and brittle. Psychological dimension. Mrs. Stenson was in medical compliance over the years. She took all her medication as prescribed. She was oriented to time and place. She had a good attitude, and there was no history of mental illness. Ms. Stenson's parents are deceased. She has one son that resides in another state. She's considered a loner. She has no siblings. Mrs. Stenson was willing to adapt to new and changing situations, and she was at the facility because she was in need of medical support. And this is an echo map of systems that Mrs. Stenson are related to. Her treatment included both over-the-counter and prescribed medications. Previous interventions, Mrs. Stenson has home health and home oxygen. While at the hospital, the physician initiated a care plan for Mrs. Stenson. Future interventions included nursing home placement in Florida so she can be closer to her son. Theoretical perspective I chose to use was the systems theory. In social work, thinking has been influenced by the work of biologists, Bertalanffy, and later adaptations by the social psychologist Bertram Meyer, who examined human biological systems within an ecological environment. Bertalanffy is credited with being the originator of the form of systems theory used in social work. And system theory simply states that systems are made up of interrelated parts that work together to create a whole. Each part of the system has an influence on the whole system. If a problem occurs in one part of the system becomes unbalanced. And in this case, the system would be Mrs. Stenson's body system, and one problem caused a shift in the whole system, and she became ill. Also, when there's an imbalance in the system, role reversals are caused. Mrs. Stenson was the primary caregiver to her son as he was growing up, but as his mother became ill, he had to take on the role of providing care for his mom. Discussion of cultural impact on the client system. Mrs. Stenson's primary language was English. Her social economic status was middle class. She was retired. She's a resident of Lee County. Another impact is aging. Mrs. Stenson is 79 years of age. And once you reach this age, a lot of people like to associate aging with death because you're getting older. Also, as individuals continue to age, there has to be a caregiver to care for these individuals because they can no longer care for themselves like they once could. This can cause a great deal of burden on the family, such as her son, who is her only child, so he has to deal with a great deal of stress. Mrs. Stenson is from Lee County, which is a rural county. There is no transit system, so if she is unable to drive or become unable to drive, transportation will be an issue. There are limited healthcare facilities as well. Potential ethical issues that could arise, the treatment at the nursing facility, confidentiality, and future medical decision-making, such as do not resuscitate orders, also known as DNR. And it's just simply an order that states if a person goes into cardiac arrest, They do not want CPR measures to be taken. Summary includes arranging home health for the patient, ordering durable medical equipment, which was her home oxygen, and future nursing home placement in Florida, where she would be closer to her son.
Good afternoon, everyone. I'm again Shanae Jan Palmore, and I did my field practicum experience at Turner Job Corps Center here in Albany, Georgia. Turner Job Corps Center is a free work-based learning and career technical training program and is funded by the Department of Labor. It helps people aged 16 to 24 years old improve the quality of their lives through educational and vocational training. The population ratio at Turner Job Corps Center is 89% African American, 7% Caucasian, 3% Hispanic, and less than 1% is Native American. The Turner Job Corps program is regulated by the Title 1C of the the Workforce Investment, the purpose of the Title 1C is to maintain a national Job Corps program throughout the national level, and is to assist eligible youth to operate in group settings, become more responsible, employable, and productive citizens. And it also sets the eligibility requirements for the program. This is a fictitious picture and a fictitious name, but the character is a real person. We'll use the name Kelsey Nichols. He's a Caucasian male, 19 years old. He is in the trade of heavy equipment, advanced heavy equipment. He was born in Washington State, raised in Alabama since age 4, and currently at Turner Job Corps Center. The presenting problem. Kelsey Nichols did not complete high school. He does not have a healthy relationship with his mother or twin brother. He was sexually molested by a relative at age 11. He's an excessive drinker and is mildly depressed. Here's some chronology. He was born in 1993. In 97, at 4 years of age, he moved to Alabama. In 2004, at age 11, he was molested by a family member. In 2005, he began drinking. In 2010, at age 17, he dropped out of high school and moved with his father. He enrolled in another Job Corps program, which he completed his initial trade of heavy equipment. He also completed his high school diploma at that Job Corps program. And in 2011, he enrolled in advanced heavy equipment here in Albany at Turner Job Corps, and at age 19, he began counseling in TEAP. And TEAP is the Training Employee Assistance Program, which at this center is used mainly to focus on alcohol and substance abuse. This is a genogram that shows Kelsey's family. You have his stepmom and biological father who are now married. His biological mother is out to the side. He had, with his biological father and mother, he has himself and his twin brother. He has 2 half-sisters from his biological father and stepmom, and he has a girlfriend that he met here in Albany at Turner Job Corps who he's in contact with daily. I assessed the problem with Kelsey from the ecological perspective. We'll start with the micro level, which includes the family dynamic and people who the client is in contact with daily. It includes his mother, his father, twin brother, and his 2 half-sisters, and also his girlfriend. At the Mezzo Level, which entails the systems that the client is involved with in his life. Currently, he has Turner Job Corps Center. He's in the Caucasian population, and he's a former Methodist. At the macro level, which includes like all the laws and policy that regulate this client's life, he has the government funding from the Department of Labor. There are different shopping facilities that the students at Turner are allowed to shop at, which includes Kohl's, Walmart, and Fred's. The agency is contracted with those businesses that allow the clients to come there. At the EXO level, which talks about the values and the mores of the client. You have American equality, American education value, and financial stability, because as we all know, a value here in America, equality, they say everyone should be on the same page as far as education, finances, and everything, but some people are not as fortunate as others. And this just shows that entire perspective from the ecological standpoint. The interventions that Kelsey has had in the past are none. He is currently having weekly individual hour sessions with the licensed certified social worker to discuss his feelings of resentment towards his mother. He blames her for his childhood molestations, and he also talks about his feelings towards his brother, because growing up, his brother was born with a kidney disease, so he's not physically as healthy as everyone else, and he was picked on in school, and Kelsey had to always act as his protector, and that's why he was always in trouble in high school. He also has group counseling, which is the TEEP, twice a week to address his excessive drinking. The plan and future interventions: he will continue currently individual and group sessions while at Turner Job Corps Center, but has made it clear that he will not seek treatment after leaving the program. The strategies will identify negative feelings towards his mother and discuss the depression he feels due to his brother's health condition and motivation for excessive drinking. Theoretical perspective, I use the behavior, it's actually a therapy. It's used to treat extensive range of psychological conditions, including but not limited to the depression. And the originator here in the United States is credited to B.F. Skinner in 1953. The cultural impact: there's no immediate interaction with his family because he is here at Turner and he has limited contact with them. The on-center living can be stressful at times because of the closed settings. And at Turner, he is out of his comfort zone because, as I mentioned earlier, the population ratio is like 89% African American. And being a white male in an environment like this, there's no way you can be extremely comfortable, because we know that we all have a different way of doing things no matter what background we come from. The ethical issue is he is a minor and is able to drink, and on center, which violates one of the center's zero tolerance offenses, but he states that he's able to drink at times, even while he's on center. The summary is he has feelings of resentment to his mother and father that stem from childhood experiences. He also expresses feelings of depression due to having to always protect his brother because of his deteriorating health. And different life events, such as his childhood molestation, have caused him to turn to alcohol, and he seems nonchalant about future interventions. And these are some pictures of some students that we got to work with at Turner, working on heavy equipment. And there's a picture of myself also. And that's the end.
Hello, everyone. Again, my name is Ladora Smith, and I did my field practicum at Turner Job Corps Center here in Albany, Georgia. Turner Job Corps is a no-cost education and career technical training program administered by the U.S. Department of Labor, assisting young people ages 16 through 24 improve the quality of their lives through vocational and academic training. It's authorized by the Title 1C of the Workforce Investment Act of 1998. This is a fictitious name and person. His name is Bentley Coop. He's 20 years old, and he is a Creole American, and he's Catholic. The presenting problem: he was unable to complete his education due to the destruction of Hurricane Katrina. It destroyed their homes and the schools. He's currently unemployed. Chronology: in August 29th, 2005, Hurricane Katrina hit, and weather reporters said it was one of the worst in a 100-year period to hit the coast of the U.S. And in September 2005, him and his family relocated with the assistance of FEMA. and he came to Job Corps July 19, 2011. And this is just a picture of where they stayed. Assessment of the problem. Hurricane Katrina put the client's life on hold. His mother lost her job, he lost his school, and he lost some friends. Client strengths, he is determined and he has family support. The client did not get to complete high school, and he does not have any employment, and he does need some counseling to cope with everything that happened. The ecological perspective. The microsystem is everything and everybody that he comes in contact with on a daily basis. And at Turner Job Corps, that is staff and students, because he does live on center. His mother, his sister, and his brother, he talks to them all the time. And the Sacred Heart of Griffin is a Catholic church. It's his religion. In family dynamics, his mother is 56. His brother is, he is 20. His sister is 16 and 18, and his brother is 14. The Mezzo system. The students at Turner Job Corps get to go off center to many different places to shop for different things, and they also go to the health department for anything that they need, such as their disability forms or anything. And the exosystem is all the laws that regulate, the laws and policies that regulate or have to deal with the student being at Turner Job Corps. And the Disaster Relief Act of 1974, which is part of what FEMA does, which is what helped him to relocate. The Job Corps Title 1C of the Workforce Investment Act of 1998, Affirmative Action Act of 1964, and public welfare programs, just because you have to be at a certain poverty level to come. This is just a small eco map. The ecological perspective is the macro system. And this one, this is what the values and cultural beliefs, nation security, which is FEMA, value of family, which was destroyed due to natural disaster, education, he's still striving to attain, cultural diversity and pluralism, he identifies as Creole, which is an ethnic subgroup in the United States. Intervention strategies. There are no past. Current intervention is Job Corps because he is there learning and getting his education. Plan future interventions. I said the student needs to go to counseling because he hasn't talked to anyone. And TEEP, which is a training employee assistance program, because he does smoke. The theoretical perspective I used was the cognitive behavioral therapy, and that was developed by Aaron T. Beck. CBT is based on the cognitive model of emotional response. Cognitive behavioral therapy is based on the idea that our thoughts cause our feelings and behaviors, not external things like people, situations, and events. The benefit of this model is that the client can change the way we think to feel or act better even if the situation does not change. CBT is time limited in that we help clients understand at the very beginning of the therapy process that there will be a point when the formal therapy will end. The ending of the formal therapy is a decision made by the therapist and client. Therefore, CBT is not an open-ended, never-ending process. Cultural impact on the client system. What happens in the family stays in the family. Many families don't like to talk about inside problems outside of the family. And therapy is for wealthy Caucasian people, which is what a lot of people believe. Cultural identity. Returning to New Orleans. Socioeconomic status. It's similar to before moving, they're not very wealthy. Risk of cancer in African American smokers is higher, and so that's one thing we want to get to stop. Ethical issues. He's still displaced by Hurricane Katrina, and one question was asked was, has the government done enough for Katrina survivors? And after doing some research, I found out the answer is really no, because FEMA is asking for the money back that they helped to relocate some families. Respecting cultural diversity. Organizations should acknowledge the diversity among African Americans because not every dark-toned person identifies as being African American. And the summary I used was a quote by Henry Wadsworth Longfellow. And perseverance is a great element of success. If you knock long enough and loud enough at the gate, you are sure to wake up somebody. And I chose this because he is a very determined young man and will one day succeed if he continues to go as far as he's going. And those are my references.
Hi, everyone. My name is Shakiva Weidman. I did complete my internship at Touchstone Dual Diagnosis Residential Treatment Center. And Touchstone is located in Albany, Georgia. It's governed by Albany Area Community Service Board. The program is a 30-day residential program for each client. At the maximum, they can only spend 30 days there. And it's like a revolving door, so you can have different group sessions where one client is on like their second day and another client may be on their 20th. So each group session is going to always have like different dynamics. They must be chemically free upon admission or must have successfully completed a detoxification or crisis stabilization program. Basically meaning that once they actually enter the program, they need to be as stable as possible from whatever drug they may be addicted to at the time. And they may have coexisting psychiatric disorder. They may be bipolar or a diagnosis being schizophrenic and so forth. They must complete a physical exam, and they must be intellectually capable of understanding the concepts that we're going to be discussing while having group therapy. My particular client that I focused on is Major Miles, fictitious name, of course, and picture, but he is a 50-year-old African-American male from Tifton, Georgia, and he reports being Baptist and was raised as such. Major was actually referred to us on February the 4th, 2012, to the Crisis Stabilization Unit because of an addiction to cocaine and alcohol, and he was also diagnosed as being majorly depressed. He was hospitalized after a cocaine overdose that he usually mixes with his alcohol use as well. He was sent on an M13, basically meaning that once you overdose on a particular drug, afterwards he was expressing feelings of harming himself or others, so obviously he wasn't trusted to be let back into society, so they referred him to the Crisis Stabilization Unit where we watched him on like suicide watch for at the latest 10 days, but for his particular case, it lasted 3 days after seeing the doctor. He was placed off of the closed unit to an open unit. For his particular life, he was born 1962. His biological father left him in 1963. His mother remarried in 1978. He did graduate high school, and he ended up enrolling in the Marines in 1983. He was drafted overseas, and he claims to have a knee and back injury from his time spent in the military. 1992, he was discharged, and after that, he claims to have first started his addiction to cocaine. He is a part of a Veterans Disability Program. Now, in 2011, his mother died, and he reports that after the death of his mother, his cocaine use was basically spun out of control, and that's how he ended up overdosing. And February the 1st was when he actually overdosed, and he was admitted to the Crisis Stabilization Center on the 4th, and that's where we began our assessment as far as his referral to Touchstone. Major is physically healthy besides his report of his chronic knee and back pain due to his time spent in the military. He has one car and one tractor-trailer truck that he definitely values, and he has been taking Restorel to help him stay asleep for 3 months now. His hazards are bad knees and back, a knee injury due to his time spent in the military that he reports. He doesn't really speak about his time and what exactly he did in the military, so that's kind of unknown. Psychological dimension. Major completed 12th grade. Upon intake, he was very angry because he did not want to be referred to the Crisis Stabilization Unit, but at that point, he didn't really have much of a choice. He was diagnosed as a psychotic with suicidal ideation upon seeing the residential doctor after 3 days of being admitted to the unit. He had thoughts of committing suicide, but while detoxing, he became alert, articulate, and concrete. His cognitive function is person, place, and situation orientated. He has recent and remote memory. His attention span is sustained. His behavior shows sign of cooperativeness. Major's verbal communication is pretty good, and psychological hazards include lack of his past memory and emotional recollection from his time spent in the military, which he, like I said, wasn't really open to discuss much. Socially, he reports being the only child. He was raised by his mother and frequent help from his aunt while not knowing his biological father. He has a stepfather who has been in his life since he was a teenager. His mother did recently pass in 2011 due to undisclosed reasons, and he is very close with his aunt, and he has a fiance, no kids, and he only reports having a few other family members, which is his support system. That's my genogram. Also, he is currently part of the Crisis Stabilization Unit group and reports going to random churches every now and then. He is in the process of being referred to Touchstone Dual Diagnosis residential program after he finishes his detoxing, and he lives in a predominantly African-American town. For his particular location, he reports that it's very easy to get a hold of drugs and so forth, so that's not very good on his end. And he is currently unemployed as a stipulation to receive his Social Security check. And Major also gets a disability check from the government for time served in the military. And these monies, he don't really have much bills that he's responsible for because he was living in a house with his mother and his fiance. So those funds did contribute to his substance abuse. And it's my eco map. He reports no past interventions. Currently, he has individual counseling sessions once a week, up to 1 hour at least. Usually, in his case, it was more like 2 or 3 times a week. But the therapeutic goal is that he would need to learn how to explain how negative consequences will affect his personal relationships, employment, depression, and health. Also, he did participate in group counseling with a licensed clinical social worker, which conducted a psychoeducational group counseling 2 to 3 days per week, and that's, in Touchstone, on issues concerning mental illness and substance abuse disorders. For future interventions, once he's actually released from Touchstones after his 30 days are up, he plans on accepting powerlessness and unmanageability over alcohol and participate in a long-term recovery-based program to develop relapse prevention recovery plan, which would include AA and NA meetings, Alcoholics Anonymous, Narcotics Anonymous meetings, and outpatient services. And Major will identify consequences of alcohol and cocaine use, including the negative impact on intimate relationships, employment, feeling of depression, and health. And he will also learn how to identify his triggers, because one of the main things that was stressed during his time in therapy was that while you're actually in the unit, you're kind of safe because you're enclosed within certain walls. So, of course, we don't have drugs or anything there, but you have to learn how to live in your own environment. And the theory that was used was the cognitive behavioral therapy. It was developed by Aaron Beck. It's a psychotherapeutic approach, a talking therapy that addresses dysfunctional emotions, behaviors, and cognitions through a goal-oriented, systematic process. The name refers to behavior therapy, cognitive therapy, and to therapy based upon a combination of basic behavioral and cognitive research. Deficiencies in our skills for coping with the antecedents and consequences of drinking and drug use are considered to be a major contributor to the development and maintenance of addictive behavior. And also, another important thing as far as therapy went was relapse prevention, because a lot of people tend to fall off the train as far as being in that particular unit and being clean and so forth, and then once you actually get back home, you immediately relapse about a week and a half later. So, cultural impact on strategies and client system. In his immediate living area, there are many avenues to getting drugs. Major Lee is currently unemployed and has a stipulation to receive his Social Security check. He also gets a disability check, and he's been using drugs ever since he was discharged from the military 20 years ago. He cannot remember the exact reason why he started, but he wishes to explore the history of his life and to find out. Ethical issues. There are currently no presenting ethical issues besides the obvious of, drug using. When further cognitive treatment is underway, discussion of this time served in the military may be necessary, but may potentially cause ethical issues due to sworn oaths and confidentiality clauses. And my summary is my analysis of intervention work with Major Miles is one of hope and planned intervention. He is 50 years African-American male who is from Tifton, Georgia. He reports being a Baptist and was raised as such. Resulting from his mother's passing, he feels abandoned. He resents his stepfather because he began a new relationship living with another woman only 3 days after his mother's death. He also expresses feelings of boredom because he no longer is employed as a truck driver. He is stable financially, but the same financial security also contributes to his addiction to cocaine and alcohol. He has been using drugs ever since he got out of the military 20 years ago. He can't remember the exact reason why he started, but wishes to explore the history of his life and find out. This was recognized when he had thoughts of suicide, not necessarily because he wanted to die, but because he did not want to continue living in his current state. He is optimistic about treatment and reports wanting to participate in a long-term recovery treatment. And this is for my classmate, because I'm sure we're ready to graduate. And I'm done. Thank you for being attentive.
Good afternoon. Again, my name is Julia Yancey. My field placement was conducted at the Henderson Community Center, located at 701 Willard Avenue on the south side of Albany, Georgia. My client, this is a fictitious picture as well as fictitious name. His name is Brian Jones. He's 8 years old, and he's an African-American male. The presenting problem, Mr. Jones is a regular attendee at the Henderson Community Center. How he began his attendance was his grandmother became his guardian, and he's not old enough to take care of himself, so after school, he needs somewhere to go until his grandmother gets home from work. She doesn't get off work until 7 o'clock p.m. He has unsatisfactory in reading, writing, and math. He has an apparent learning disability, but there has not been any formal testing. Brian also has a severe issue with anger, and his grandmother is concerned with the impact that the gangs may have on her grandson. History of presenting problem. Brian has lacked stability throughout his life. His mother battled drug addiction and has been in and out of his life. He does not have a relationship with his father and has never met him. His mother abused drugs during her pregnancy and after giving birth. This also contributes to his learning disability and his issues with anger, because we know that drug use while pregnant can cause harmful effects to the fetus, such as mental disabilities, learning disabilities, and issues with anger. Brian's grandmother became his guardian at the age of 2. His grandmother is also 62 years old. She was not working, but after becoming the guardian, her Social Security income was not enough to support him and her grandchildren, so she went back to work. And this is a timeline of the events. The red font represents traumatic events and stressors in his life. He was born May 25th, 2004. At 6 months, he moved in with his grandmother along with his mother. At the age of 2, his mother gave birth to a younger brother. And shortly after, his mother left with his brother, but Brian remained with his grandmother. And that's when she became his guardian. At the age of 4, in 2008, his mother returned, and then shortly after left again, this time leaving both sons behind. In 2009, he entered kindergarten at Alice Coachman Elementary, but he was behind in his writing skills, so he was kept back. Because his mother was in and out of his life and his grandmother is so far in age, he never had that one-on-one that you get with your mom and dad as far as writing your name and learning your address, so he was behind his classmates. So he repeated kindergarten, and then after that year, he was somewhat caught up, but still not quite on the level as his classmates, and then he was allowed to go to first grade the next year. When he was 7 years old, his mother moved back, and that's where she stayed for a while. 8 years old, he attended second grade. He's still at Alice Coachman Elementary. Shortly after the holidays, his mother was incarcerated, and then that's when he began his attendance at the Henderson Community Center when school started back. My assessment will be done from the biopsychosocial perspective. The biological dimension. He has normal physical growth and development despite his mother's drug use and during her pregnancy. His physical health status is normal. He has no issues with mobility and does not take any medications or require medical assistance. Brian is also free of biophysical hazards. Psychological dimension, learning disability, which I stated earlier, he has not been formally tested, but there is an apparent that he does have a disability. If you notice when he's writing, he writes his C's and S's backwards, something that you learned early on, and he's still doing it as an 8-year-old. It can also be contributed that his house that he lives in, his grandmother's house, is old, and studies shown if the house was built before 1972, lead paint was used, and that also can influence a child's learning disability or aggressive behaviors. He has delays in processing and retaining information, which is why he struggles in reading, because he'll read something, but he doesn't comprehend and understand what he's reading. And he also has trouble with math. And he has trouble expressing anger, and that often results to violence. He's very quick to ball up his fists instead of using his words. Psychological hazards. Brian's learning disability has impacted his self-esteem and also contributes to his anger. Brian is sometimes teased by his classmates because of his learning disability, which in turn causes him to lash out through violence. Social dimension. He resides in a low-income community. He receives support from his grandmother, his teachers, and staff at the Henderson Community Center. When he arrives at the Henderson Community Center, the first thing we ask to see is a progress report from his teachers so we can see where he is in class and make sure he's keeping up. His teacher has recommended after-school care to keep him caught up. And also, if he does fall behind or gets into fights at school, he is not allowed to participate in any of the activities for that day. And he is not allowed to leave and go home. That keeps him out of trouble and out of the streets. Faith Baptist Church, which is the church his grandmother attends, they donate groceries to the family to help them out. And there's a high gang activity. I'm not sure if you all are familiar, but there are 12 active gangs in Albany, Georgia. On the south side of Albany is mainly Bloods and another gang called the Southside Boys. They are constantly recruiting younger kids for drug distribution, and his grandmother is very fearful, and he is an at-risk youth. Past interventions. Brian has not been formally diagnosed with a learning disability, nor has his problems with expressing anger been addressed. His current interventions are after-school tutorial to keep him caught up with his academic progress, and sports and physical activities to develop coping mechanisms for managing his anger. At the Henderson Community Center, they teach you to act as a team. So if a teammate does something that you do not agree with versus fighting, you guys talk about this, kind of helps him as far as assessing the problem, stopping and thinking why you're mad, is it worth fighting over, and then going forward from there. They're considered a family, so you don't want to hit your family or harm your family. Future interventions. Special education. This will include his grandmother meeting with the school social worker in regards to enrolling Brian in the proper classes that will cater to his learning disability. This will prevent him from falling further behind his fellow classmates. And again, sports and recreational therapy. The Henderson Community Center uses sports such as basketball and football to channel Brian's aggression into a positive energy by teaching discipline and control. Cultural impact. Being an African American male in Albany, Georgia is not without difficulties. Although Albany is predominantly black, racism is still very present. The ability to advance to a higher economic status is complex. The times have changed and the mindset of the oppressed has changed for the worse. Where our ancestors once fought for the right to own their own homes and businesses has now been replaced with a generation complacent with government handouts and no desire to work, and they have become prisoners of their own minds. Regional living. With the existence of 12 active gangs in the Albany community and gang initiation and drug dealing being glorified as a testament of a real man, our male youth are constantly falling victim to a life without means. Despite its rural influences and surroundings, Southwest Georgia does create chances for opportunities through its higher learning institutions. However, without proper guidance, these resources can seem unattainable, thus poverty is passed down from generation to generation. The south side of Albany is an impoverished area dependent upon the housing assistance and TANF, which has become the accustomed lifestyle of the population. This is a picture of a blood gang at the top. That's their sign that they throw up. Ethical issues. Gang members are not, they're not turned away from the community center. The community center is open to all. And the presence of gang members at the community center can be very harmful for the kids because they're easily influenced. They see the gold chains and they think this is cool, this is how I want to be. However, they do not allow fighting or any type of gang activity inside the gym, but the fact that it's still around and present around the children is an ethical issue. Also, there are doors around the entire building, but they are chained all except for one. It's supposed to be a preventative method to keep people from coming in the gym and damaging property or stealing equipment. However, if something was to break out, such as a fight or a fire, it'll be hard to get everyone out without anything traumatic happening or anyone getting seriously injured because there's only one way in and one way out. Summary. From working with Brian, I have realized the importance of mentorship in children's lives. There are hundreds of children who lack the support they need to truly thrive in society. Even though Brian has an unfortunate situation at home, he is a very eager child, even in spite of his learning disability. With the right resources and support, he has the opportunity to do very well. However, if he is unable to continue attending the community center, or if his grandmother fails to give him the proper educational attention, he has an even greater chance to succumb to the negative lifestyle portrayed around him. The end. And, oh, sorry. And how this relates to social work is, many of the community centers that are free, or some programs that are free that are offered, such as NYSP that's offered here, those are mostly attended by the disadvantaged and at-risk youth. They come because they get free health care, they get free health screenings, they get free food, and as social workers, these are the populations who are children who have been abused, molested, runaways. At NYSP, the attendants, some of them are from Open Arms and from the homeless shelters and runaway centers. And to the untrained eye, when you see things such as inappropriate touching or stealing food, you think, oh, this child is just bad, or they're mannish, they're being too grown. But to a social worker, we know it as a sign of child abuse, sexual molestation, or neglect. So, as social workers, if we could reach out to the community, then we would have a better portrayal on the community, because the community still sees us as the people who take children away from their families when we do so much more than that. The end.
Excellent. That brings us to the end of our presentations, and I hope that you have enjoyed them as much as I've enjoyed them and enjoyed directing these students in their learning process. As I tell them in the beginning of field, I'm not going to teach you anything. I'm going to sit back and you're going to demonstrate to me what you have learned over the past 2 years in our program, and I guide that learning, and it's been an absolute joy and treat to work with them. And I don't know if the next class that's coming can top this, but we'll see. We're also blessed to have in our presence the winner of the last year's symposium, and I know that this is impromptu, but since he's in the audience, I'm going to ask him to come up and say a few words of encouragement to our graduates and the ones that are coming. Mr. Theodore Outley.
One of the things I have learned by being in the social work program, you will be put on the spot when you least expect it. As a social worker, you will always be called on to say something, to encourage, inspire. But I would just say congratulations to the class of 2012 spring class, the seniors. This is it here. The next stop is the Civic Center, going across the stage, getting your degree. So, stay encouraged, be blessed. I enjoyed everybody's presentation. It was very informative. You all did an excellent job. And I want to say you all topped last year's presentation, but I don't want to put it like that, But job well done. And whoever wins, Godspeed, because we all are winners. Thank you.
Thank you, Mr. Outley. And for the rest of you who are still here, we are having a reception in Ballroom 2, and I would like for you to join us there. And enjoy the rest of the day. Yes, ladies, I will see you at graduation. Please, no stilettos. We want to get out early because you all take too long to walk across the stage in those high heels. Thank you.